please allow 3 to 4 hours for your numbing to wear off. Avoid eating solid foods until the numbing wears off in order to avoid accidentally biting your lip or tongue or burning yourself with hot foods. Try not to eat, but if you're hungry, stick to a soft food diet or drink a smoothie until the numbing wears off. Apply cold compresses to affected area at 10-minute intervals for the first 24 hours to minimize swelling. Continue biting on your gauze for 60 minutes after leaving our office, but don't stop biting on gauze until the bleeding has completely stopped. With clean hands, change the gauze as needed, especially when it starts to get soaked with saliva or blood. However, do not remove gauze every few minutes just to inspect the wound. Keep your head elevated. Return to the office if your bleeding resumes and then doesn't stop coming out of the extraction site even when applying gauze for 60 minutes. If for whatever reason you cannot get in contact with us and you feel you are in an emergency situation, immediately go to the emergency room. Pain can range from 0 to 10 depending on the patient and depending on the tooth. If you were prescribed medication, it's critical to take as directed to receive the best effects of the medication. Place an alarm on your phone to take the medication by the clock. If you are not prescribed medication, you are welcome to take ibuprofen, Tylenol, or Aleve as needed and as directed on the packaging. Pain, swelling, and limited mouth opening is normal in the first 3 to 4 days. For 3 to 4 days, avoid the following things to prevent excessive bleeding. Do not smoke, suck through a straw, or spit out vigorously. Stick to a soft food diet and avoid consuming spicy foods. Avoid eating foods that are hard, crispy, or any foods that can break up into small particles like chips, nuts, or anything with seeds. Avoid consuming anything hot like soup or coffee. Avoid carbonated drinks, caffeinated drinks, or alcoholic beverages. You are encouraged to rest. Avoid physical or strenuous activities, especially lifting heavy items, to avoid excessive bleeding. For 7 days, it's normal for extraction sites to look bruised, yellow, red, white, and inflamed. You are welcome to rinse with warm salt water 24 hours after your extraction, but do not use mouthwash or any other rinses. Use only a toothbrush as your dental home care with gentle brushing to keep extraction sites hygienic. Do not use any other form of dental hygiene home care until 7 days are up. Again, do not spit or rinse vigorously. Just let the fluid passively fall out of the mouth when rinsing. If you receive stitches, allow 7 to 14 days for the stitches to dissolve by themselves. Be aware, it takes about 14 days for tissues to heal and look normal and pink again, but it takes at least 6 months for bone to completely heal. Any questions or concerns, immediately call our office.